If you're watching this video, it means we've talked about the fact that you've torn your MPFL and we're going to reconstruct it. The surgery we're talking about is an MPFL reconstruction. It's a ligament that runs from the medial portion of the femur to the medial border or inside of the patella or kneecap. And it attaches to the patella to prevent it from subluxing laterally or dislocating. The ligament itself is reconstructed using a tendon. It's usually a hamstring, and it can be done using your own hamstring or donor hamstring depending on what we've talked about in the office. The surgery itself is done as an outpatient, which means you'll come in the morning, go home that afternoon. It's done under regional anesthesia, which means we'll numb you up from the waist down. We'll give you some sedation through an IV so you'll feel like you're sleeping through the surgery. It takes about 60 to 90 minutes to perform, and you'll wake up in the recovery room with the knee in a brace, and you'll start to get sensation back and be taught how to walk with crutches with our physical therapists. They'll also show you how to use a very important machine called a CPM, which is called the Continuous Passive Motion Machine, which you will be required to use 3 times a day in order to regain your motion at home. You'll go home with pain medication, which are narcotics. These have side effects such as sedation and constipation, which you should be aware of. And you'll continue to use those usually for about 2 weeks after the surgery. You'll see me in the office between 10 and 14 days, at which point I'll remove the sutures and we'll check your range of motion. You'll see one of my therapists around 4 weeks so that they can start showing you some exercises for your quadriceps. And then you'll see me back at the 6-week point to start you with formal physical therapy and begin to allow you out of the brace. At the 3-month mark, we'll see you back. Sometimes you're in a transition brace for that 6 week to 3 month period, depending on how strong your quads are. And then at 3 months, we'll allow you to progress with physical therapy to regain full strength. Most patients are back to full activity and sport between 4 and 6 months, depending on how long it takes to get your strength back.